Hey guys, it's coronavirus day 440. Wow. And stay at home order then to day 49. So just before I start, just a reminder, please just due to risks and possible way forward, don't have any gatherings of any kind. Who knows who might get affected? So, for safety concerns, requested by doctors, not the government. So you'll actually be surprised by the coronavirus cases today. The coronavirus cases today reports at 1,095. You heard me correctly. 257 cases are from Toronto, 215 from the Peel region, 123 from the Durham region, and 101 from the York region. Of course, lower cases from Toronto and Peel region. Compared to the previous ones, and York region is has been trumped by the Durham region and other regions. So all other regions have reported 100 cases. Okay, not good news. 23 deaths have been reported. Variant cases. UK variant is at 121,122. Not our biggest threat. An increase of plus 992. South African variant 836. An increase of plus 19. And Brazilian variants at 2,505 plus 43. The second highest threat and biggest threat we've actually had, so that's a big concern and of course the India double-mutant variant was last revealed at 45, but I know blame it on the provincial government, public health, Ontario, and the federal government for not showing the actual update and actually mass screening, unlike the other three mass variants of concern as is labeled. So it's who knows when they'll actually update it again. And the government hasn't done much. They definitely approve of that. So vaccine bookings. So if you want to book your vaccine, I got vaccinated today. So you can book your vaccine at COVID-19.ontario.ca/book vaccine by phone 1-888-999-6488. At a pharmacy, you'll have to wait. Through local health unit networks, vaccine bookings are available for those 18 up right now, but as of May 31st, the Pfizer BioNTech vaccine, use 12 to 17 they can available to get their vaccine shot. So and the ruler down below, for and maybe the Moderna vaccine will be also available for use. We don't know, but they're testing. They're doing a trial right now, so if youth, if they're not age 12 yet, they can pre-book through 1-833-943-3900 or through local public health units. So yeah, those are the only two options available. So yeah. Stay-at-home order ends June 2nd. And what I wanted to talk about is, you know how there was that incident with how there like some people who want like some healthcare professionals and people who work with students, like you know, kids and also sick kids in Toronto and Children's Hospital of Eastern Ontario. So both children's hospitals also joined that, and they're trying to request the government to reopen schools. And Dr. David Williams, he's Ontario's top doctor, although there's some reason that we can't trust him. So he said on he would like to see students return to the classrooms before the province starts reopening in mid-June. So ouch, because wait a second. Because there have been some healthcare professionals, teachers, parents, and saying no, we should wait till have a safe summer and have a safe September, but you know. And they also, these people also noted that there is a flaw in the plan. If we're going to reopen the schools in Ontario right now, because especially mentioning there's no air conditioning, ventilation is terrible, and of course students will have masks on. There's going to be sweat and buckets, and of course sometimes some windows the temperature is going to be like that freaking hot, so how are we going to deal with that? So yeah. So that is so even though they want to reopen schools, we need to please consider that situation right now. So I mentioned in the last video previously. So even if there was safety measures and there's been mention that fans are not allowed in classrooms in some school districts. So okay. And how are the students going to deal with that, right? And but if this reopening thing, sure, it might be for the good for the mental health for students, for kids, but it could be making things worse. I think that these people who want to reopen schools, they need to really rethink their plans, and one is some things that can work and things that can not work. Because I don't think sure they're only thinking about mental health. Yet there's several flaws in their their what they want to happen and what stops them from doing that. So Dr. David Williams, yeah, he should not be reopening schools. No, no. And and Stephen Lacey, who is in charge of the schools in Ontario. No, schools should not be open yet. Play it safe than better safe than sorry. The EMCPA rules down below, 700, the charges. So hospitalizations is at now at 1,073, okay, so plus 48. 672 ICU patients, minus 20. 469 ICU patients using a ventilator, minus 29, okay, that's better. The long-term care home, that has not changed, 3,771 deaths, okay. Staff deaths is still the same. 33 outbreaks right now, so minus, minus 2. So, please follow coronavirus safety rules and regulations and stay-at-home rules. Don't have any gatherings for the safety of others. And if there's any gatherings, the officers will most likely charge you off the EMCPA rule. $750 per person. Sometimes $130 surcharge. Depends. And if you organize the thing, 10,000. And 10,000 for trying to prevent it, and 1 million if it's severe, and possibly even jail time. So, go and sign up for vaccinations. I hope schools, the one thing I hope for is in school in-person graduations to happen again, and possibly and a safe summer and a safe September reopening of schools instead of reopening schools now, because people should really the people who really want it reopen should really rethink their ideas. Sorry, sick kids and Chio, I'm not with you on this. I'm not on board with you.